Hi, I'm Dr. Pautz. I head the Persephone Healing Arts Center in Jacksonville Beach, Florida. I am board certified in internal and integrative medicine. I hold several other certifications, such an herbal fellowship, also an integrative neurology fellowship. I'm a Walsh practitioner. I'm a certified eurythmist, an art of movement that we teach in the Waldorf schools, and wear a bit multiple different hats depending on the biggest need of the hour for my patients that are going to come and see me. Our phone number is 904-246-3583. This video is about neurodegenerative illnesses. We have a profound increase in occurrence of neurodegenerative illnesses in older age. Little bit scary at times here. Even people who don't have a family history can have a significant occurrence of these illnesses. I will name a few common ones, and the list is far from complete, okay? But one of the most common ones that we all know is Alzheimer's disease, Parkinson's disease. There's multiple sclerosis that can affect younger people too. Then there is ALS, or also called Lou Gehrig's disease. And again, there's many others. There's also the autism spectrum and the autistic disorders, which often present at a very young age. And interestingly enough, some of them have certain commonalities with other neurodegenerative illnesses like Alzheimer's in older age. There are certain commonalities in brain function and also in behavior that are overlapping with these illnesses that happen at both of the extremes, the young and the old. So the fascinating thing is that on one level, these illnesses are often presented as, irreversible, progressive. It's sort of definite decline thing with an average significant reduction in life expectancy over a few years only. And the sad thing is that there's estrangement in recognition to people that those people have known their entire life. So it's a challenge for the family to care for these people and the nursing homes, whoever, wherever they are. All right. So it's interesting that sometimes, for me, it's always interesting what can be done. Why do people not follow the typical decline? Why do they stabilize? Why may they even improve in some of their decline that they experienced and reverse some of the decline? What is driving those things? So more and more research coming out with certain things. And again, then I also really think it's the personal intention, whether somebody still has goals, interests, feels they are not done with life, to kind of fighting that. And of course, like with any other illness, it's common knowledge now that lifestyle intervention, exercise, whatever that may be, the gym, outdoors, hiking, biking, swimming, martial arts, any yoga, any kind of these movement things really help to slow the decline of any kind of illness. Nutrition is a huge factor. We questioned this many years ago, or some people question it. Some of us never question it, but what you put in is going to sustain your physical body, and the healthier you eat. And it's not about a fanatic diet one way or another, or cutting whole groups out. That's not how I teach nutrition. There are certain improvements with certain dietary disciplines for a certain time, but again, lots of fresh fruits and vegetables and water intake, no matter whether we eat meat or not eat meat or wherever we belong there, is definitely improving our physical health and also our mental health. So there is the lymphatic system in the periphery that we all have heard about over and over again. It's sort of a cleaning thing. It cleans up. It's sort of traveling. The lymphatic system and vessels are traveling along with the veins and the arteries. They're less defined than the veins and the arteries. And in the central nervous system, it's called the glymphatic system. I hope I'm spelling it right here. GLYMPHATIC, glymphatic system. And that's sort of also the cleaning stuff, the in-between where the nerve cells are bathing in, the central nervous system is bathing in, whether it's in the head or in the spine. The spine is central nervous system too. And they they do the movement and the cleaning job, okay? Everything in the body has intake, outtake, cleaning, maintaining. So there's stagnation in those systems underlying any of these illnesses, Alzheimer's, Parkinson's, multiple sclerosis, ALS or Lou Gehrig's disease, and many other of those neurodegenerative illnesses. So that's a fascinating thing, that there's an underlying thing that actually starts to be the breeding ground for other things to become abnormal. Then, of course, these illnesses present very differently. You know, Alzheimer's, the biggie on memory loss, not remembering anything anymore, having more and more senior moments, not finding your keys, starting not to remember names, and not being able to remember how to get from one place to the other in a car. You know, things have different stages. Parkinson's, the tremor, this rigidity, and so it is for all the other illnesses, ALS, anterior horn cell deterioration, and inability to function and intervene the peripheral muscle system, so people are losing control over their body. So all these kind of illnesses have a pretty scary increase in occurrences, even without family history. Now, ALS, 90 to 95% is sporadic, so it's not familiar. Only a very, very small part of ALS is actually genetic, inherited or whatever. So people who have goals, who are willing to continue learning, you know, Alzheimer's, social interaction is a biggie. By the way, what's the biggest risk factor for youth? It's not diet, it's not water intake, it's not exercise, all these kind of things. It is social isolation is the biggest risk factor for youth, for teens. Interesting, right? So social interaction has a major supportive factor of slowing the progression of any of these illnesses down. Then there is supplementations of certain antioxidants that have shown to be beneficial. Then there is also herbal things that have shown to improve memory or sustain memory. People eat a couple of cookies that are based in some of these herbs that have helped with memory, for instance. So it's interesting to look at what can sustain, slow the progression, stabilize the progression, halt the progression, even if it's temporary. Sometimes that can be years, or even reverse some of the progression, where people had severe memory loss, didn't remember names or didn't recognize their own family members, and all of a sudden remember their names again, want to go shopping, or things they used to love to do in the past, going out and having a good meal in a good restaurant. So there is meditation, for instance. There is data showing that people who have a very disciplined meditation thing have actually the loss from Alzheimer's, when their brain can shrink, their brain volume, and you can measure this in a CT or an MRI, they actually have a reversal and increase their volume of their central nervous system again. Fascinating, right? It's not even a drug intervention. So all these things are just really, really encouraging, that there is probably a lot of things that can be done. We know it from individual cases where people are willing to fight and do things. They are paralyzed of a car accident. They practice, and they get walking again because they find it unacceptable that they will be paralyzed for the rest of their life. So there's a lot of things where we used to think in the past that everything is irreversible or there is no nerve regeneration. We know today that there can be nerve generation. And then it depends on the will force of the patient and then the support system, whether they can manifest some of this and implement that in their own personal life. Thank you so much for listening. Our phone number again is 904-246-3583. Our website is www.drpautz.com, drpautz.com. We have monthly open houses. And again, my interest in neurodegenerative illnesses, I was pushed into this also because of a personal story, personal family member being affected with that, still doing remarkably well many years into the game. Thank you so much. Thank you for listening. And hopefully we will see you at one of our open houses. Bye-bye.